Hi everyone, this is going to be an instructional video on how to give a proper CHG bath to your patients in a clinical setting. First and foremost, you will gather all of your equipment that you need before going into a patient's room, such as a new clean gown, towels, washcloth, a bucket to put warm water in, and then your CHG soap, of course. Once you get to the patient's room, you will do your hand hygiene, make sure you clean your hands thoroughly, and then put your gloves on once you've finished with that, which we've already done. Once you put your gloves on, you just want to make sure that you keep your hands sterile and only touch the equipment that you're going to be using on the patient, just so you keep germs away from your patient. All right. Then once you get in the room, you'll speak to your patient. You'll want to explain everything thoroughly before touching the patient so they know exactly what you're doing when giving them a bed bath. So, Mrs. Smith, we're going to be giving you a bed bath today. We're going to start by, warming our water. We're going to grab our warm bucket full of water, our CHG soap. And then you'll want to level the patient to where you're able to reach all extremities. And then what you do is you're basically going to take your warm washcloths. You're going to grab one at a time. And what you want to do is you want to use one washcloth. You want to pump your CHG soap on there. And you want to use it one washcloth per extremity. So, Mrs. Smith, before we do that, I'm going to unbutton your gown. And while you're cleaning, you want to keep your patient as covered as possible, just so they're not so exposed while giving the bath. So as you use each clean each extremity, you're gonna act accordingly. So first, you're gonna take your first washcloth. You're gonna put your CHG soap on there, and then you're gonna take it and wash the arm thoroughly first. I like to start with the arm first. Clean each finger. Nails from the other arm. You can even clean first of the shoulder part with the first washcloth. Okay. Then what you do is you'll have a green linen bag and you'll toss each washcloth and towel there. Okay. Then we'll dry off. And a lot of times the CHG soap will air dry itself, but a lot of patients prefer you to pat them down a little bit so they're not so wet. We'll keep that towel to the side. All right. Then next, you'll do the other arm with a new washcloth that you'll grab from your bucket. All right, Mrs. Smith, now we're going to clean your chest, and then take a new washcloth, clean this way, and we'll also clean their torso section, keeping their lower half covered just so they're not so exposed. Put CHG soap on there. And sometimes with patients, they can help you out if they're able to. A lot of patients prefer to either help clean out their face or their arms, or even above their lower extremities if they're able to or feel more comfortable doing themselves. Or a lot of times we have patients who aren't able, obviously, if they can't use their arms or they're not coherent enough to do so. So you just want to make sure that you're super gentle and easy when cleaning, and you are explaining each step of the way so they're fully aware of what you're doing, so you're not just kind of jumping them there with the soap and water. All right, so we'll clean that. And then once we clean that half, so like I said, you want to kind of keep them covered throughout, we're going to take the new gown. All right, Mrs. Smith, we're going to put this new gown on you before we strip your old one. You're going to take the new gown, put their arms in first. Okay. And then you'll want to tie it behind their neck. Okay. All right. Once that half is clean, you'll fold it, get rid of the dirty gown, throw it in the linen bag along with the dirty washcloths. All right. Take one washcloth for each leg. Okay, Mrs. Smith, we're going to be pulling your legs off. Clean your feet. All right. Okay. There's that there. And then after that, we'll kind of pat their legs dry. All right. Okay. And once we do that, we're obviously going to want to clean their backside. So usually you'll have a team of 2. It's just easier to help roll patients over, get the job done. So first you'll want to tell the patient which way they're going to roll, or you can ask them if they have a preference on which way they prefer to roll first. All right, Mrs. Smith, what you're going to do is you're going to give yourself a hug, and you're going to take this left arm and you're going to roll towards Molly. And then take this washcloth, squirt it with some more CHG to clean the rest of them. All right, then we'll clean their backside, make sure their back is all clean. Their bottom is clean. Make sure to clean the back of the legs one more time, just to make sure that you got everything. Okay, perfect. All right, Mrs. Smith, you are completely clean. We got the CHG bath done all on ya, so now you're good to go. And CHG just helps you, prevent hospital-borne infection, keep you clean, make sure that, your IV source stays clean. We want to make sure that always stays clean and keep out infection. All right, and then that's how you give your CHG baths. And you want to just make sure that whenever, like I said again, whenever you're giving baths, you want to make sure you use your CHG soap, explain the importance of CHG, and make sure that, you're always keeping your patient not completely exposed. You want to keep them decent, make sure they're comfortable with the whole process, make sure your hands and your area is clean at all times, make sure you're using clean equipment, just to make sure that you prevent hospital-borne infection.